Clay and Lizzie here. This video is part of our free 22 clinical skill demonstration series, but our full course, GatorCNA On Demand SurePass, takes it to the next level with quizzes, mock exams, and a straightforward path to passing your exam on the first try. Sign up for a free preview at www.GatorCNAOnDemand.com to get access to 3 full modules and see why 92% of our students pass the state exam. This skill is provide a resident with a partial bed bath and back rub. The candidate is asked to bathe the resident who is in bed and who is not able to help with his or her bathing. For testing purposes only, the candidate is asked to just wash part of the body so the technique can be evaluated. Instructions ask the candidate to wash the resident's face, neck, back, one hand, one arm, the chest, and abdomen. Soap and water should be used for bathing. The resident also needs a back rub. When completing the skill, a mannequin is dressed in a clean hospital-style gown. A mannequin is used for the role of the resident. Follow along in your student manual. Start each skill the same way by knocking on the resident's door. Greet the resident by their preferred name, introduce yourself, and describe the care you're about to provide. Hi, Miss Kamia, how are you doing today? Good? My name's Lizzie, I'm your nursing assistant, and today I'm going to provide you with a partial bed bath and back rub. Is that okay? Great. Let me go wash my hands, gather my supplies, and I'll be right back. If this was the first skill on your care plan, you'll need to physically wash your hands at this point. If this is the second or third skill on your care plan, turn to your NAE and say, I will wash my hands at this point. When gathering your supplies, you can use the overbed table and bring it with you to the cabinet and dresser. If you'd like to select your items one by one and bring them back and forth to the table, you can do so. Just make sure you're not holding any clean items against your dirty uniform. There's not a lot of room on the overbed table, so you always want to be strategic with how you place your items. The first supply we're going to grab is a barrier towel. Open this up and spread it out over the table. This will protect the table from any water spills or any dirty linens that we collect throughout the skill. Next, grab a gown. We're going to leave the resident in a nice clean gown at the end of the skill, so we're going to stack this on the bottom since it'll be one of the last things we use. Next, grab a towel for drying the resident. Grab a towel for providing privacy to the resident. Next, grab enough bed pads to protect the bed in the area that we're cleaning. For this skill, we'll be cleaning from the top of the head to the bottom of the back, so we need to protect this area of the bed. Now, bed pads come in different sizes and shapes. If you have a small bed pad, you may need several of these to protect the bed. If you have a large bed pad, you may only need one. The facility you're testing at may have reusable or disposable bed pads. If you have a reusable bed pad, take it to the linens at the end of the skill. If you have a disposable bed pad, take it to the trash at the end of the skill. Finally, you'll grab 5 washcloths. 1, 2, 3, 4, 5. These will be used for bathing and rinsing the resident. Now we'll head over to the dresser to continue gathering supplies. You'll need a basin to fill with warm bath water. You'll need liquid soap. And you'll need lotion for that back rub. Finally, grab a set of gloves. We've now gathered all of our supplies and we're ready to start prepping the resident. Let's go ahead and put on our gloves before we start prepping the resident. Put them on one at a time. Next, we'll need to get the bed pads in place, so we're going to need the resident to lay on their side to get them in place. Ask the resident to scoot towards you and then roll away. Because the resident is played by a mannequin, you'll have to do all the moving and turning for them. All right, Miss Camelia, on the count of 3, please scoot towards me. 1, 2, and 3. Thank you. Ask them to bend the leg closest to you and lift the arm furthest away. All right, on the count of 3, can you please roll away from me? Ready? 1, 2, and 3. Thank you so much. Make sure your mannequin is balanced before you start moving on to the next step. We'll take our bed pads and get them in place to ensure that we're covering the bed from the bottom of the back to the top of the head. Roll up the bed pad about halfway and tuck it underneath the resident. If you need to use multiple bed pads, make sure they overlap on the bed. This way, no water can drip down between the cracks and get the sheets wet. While the resident is already on their side, I can go ahead and untie their gown. All right, if you'll go ahead and roll back down for me on the count of 3. 1, 2, and 3. Thank you. And if you'll please recenter yourself for me. 1, 2, and 3. Perfect. We're now going to walk around to the other side of the bed to finish unrolling those bed pads. All right. Once again, I'm going to ask that you scoot towards me and then roll away. All right? 1, 2, and 3. Great. And I'm going to ask you to put the knee closest to me, up, the arm further away from me, up, and this arm on your belly. All right, and on the count of 3, we're going to roll. 1, 2, and 3. Thank you so much. I can now see the exposed bed pads over here and finish unrolling them to fully protect the bed. And can you lay back down for me? Thank you. And go ahead and recenter yourself. So now you can see from the top of the head to the bottom of the back, the bed is protected with the bed pads. Next, we're going to need to remove the gown. I want to ensure that I protect the resident's privacy during this transition, so I'm going to take the privacy towel and lay it on top of the gown. For demonstration purposes only, we're going to pull down the towel and show you how to remove the gown. But remember, when you're actually performing the skill, make sure this is all happening underneath the towel so she stays covered. Gently remove the gown from each arm. Avoid bending the arm in a weird or unnatural way. Bunch it up and set it right here on the resident. You'll now walk around to the other side of the resident to remove it from the other arm. Once again, gently and slowly remove the gown from the arm, avoiding dragging it across the skin to prevent shearing. Slowly bunch it up and remove it from the mannequin. You can now take this to the hamper. Now that the bed pads are in place and our resident is covered with a privacy towel, we're now going to fill our basin halfway with warm bath water. When your basin is about halfway filled with warm bath water, turn the water off. Ask the resident to test the temperature of the water before moving forward. How's this water feel? On test day, the NAE will actually reach across and test the temperature of the water. When it's a good temperature, you can set it on your table and throw in your washcloths. We're now ready to begin cleaning the resident.
Want to make sure you pass the Florida CNA exam? Our full course, GatorCNA On Demand SurePass, includes all the support, resources, and tools you need to prepare you for the Florida CNA exam with a full money-back guarantee. Sign up for a free preview at www.GatorCNAOnDemand.com to get access to 3 full modules and see why 92% of our students pass the CNA exam.
The face is the first part of the body that we're going to wash. It's the only part of the body that doesn't require soap. We're going to get one washcloth and wring it out over the basin so we don't drip water on the floor or on the bed. Take your washcloth and fold it into fourths. With each mucous membrane or opening to the body, we need to wipe it with a clean surface. By folding it into fourths, it allows us to use 4 clean surfaces. 1, pull it down to reveal a second clean surface, pull it down to reveal a third clean surface, and pull it down once more to reveal a 4th clean surface. The first part of the face we're going to wash is the eye. We're going to start from the center and work outwards. 1 wipe. Reveal your new clean surface and clean the other eye. From the center, wipe outwards. Pull the washcloth flap down again and reveal another clean surface. We'll use this to clean the cheeks, the forehead, the other cheek, and the chin. Pull down another flap to reveal the last clean surface. This will be used to do 1 swipe across the mouth. We're now done with this washcloth and we can set it to the side. Now that we've washed the face, we'll need to dry the face. Take your drying towel and make sure that we're using a clean surface with each area of the face that we dry. You can do this in several ways. I'm going to create a mitt. I wrap it around my hand, and I'm going to wrap this part of the towel up just to maintain control of it. I don't want this towel to touch the bed or touch my uniform. With this clean surface, I'll pat the eye dry, starting inward and working outwards. I now need a new clean surface of my towel, so I'll unravel it and move my hand down to a clean spot. I again wrap this up just to maintain control, and now I'll pat dry the other eye. I need a new clean surface for the cheeks and forehead. So I'll create this little mitt. Pat dry the cheeks, forehead, and chin. Once again, unravel the towel and find a new clean spot. We're going to pat dry that mouth again. We're done drying the face, we can set this on our table. Now that we've cleaned the face, we're going to move on to the torso. We're going to clean the chest, the abdomen, one arm, the hand, and the armpit. Grab a washcloth and wring it out over the basin so we don't drop any water on the floor or on the bed. Apply 2 to 3 pumps of soap and rub the washcloth together to create a lather. Don't rub this over the basin so we don't get any soap into our clean water. When you notice some bubbles, you can start washing the mannequin. We'll start with washing the chest. We're going to briefly expose the mannequin so we can clean under the breast. Lift with the back of your hand and do 1 wipe under each breast. Cover them back up and finish cleaning the abdomen underneath the towel. You'll now clean 1 arm. If you need to lift the arm from under the towel, you can do so and lay it right on top. Clean all sides of the arm. Get the forearm, the palm of the hand and the top of the hand, in between each finger, and the armpit. We can now set this washcloth to the side, and we're going to get a clean washcloth with no soap to rinse. We're going to rinse the mannequin in the same pattern that we washed them. Start with the chest. Remove any bubbles that you see. Briefly expose them and lift each breast to clean underneath. Cover them back up and clean the abdomen. Now we'll clean the arm, again removing any soap or any bubbles that we see. Rinse the palm of the hand and in between the fingers. And finally, rinse the armpit. Now that we're done rinsing, we can set this to the side. Now that we've washed and rinsed the torso, we can now dry them. Grab your drying towel and pat dry in the same pattern that you used for washing and rinsing. Briefly expose them to dry under the breast, lifting with the back of your hand. Cover them back up and dry the abdomen underneath the towel. Pat dry the arm. Clean between each finger and dry the armpit. We'll need our drying towel again, so we're going to find a new clean spot on the towel and set it down on the table so we know that it's a clean surface when we have to pick it up again. Now that we've washed the face and torso, it's time to clean the back. We're going to ask the resident to scoot towards us and roll away to expose the back. We're going to try to keep them covered with the privacy towel as much as possible. All right, could you please scoot towards me on the count of 3? 1, 2, and 3. Thank you. If you'll bend the knee closest to me, raise the arm that's further away, and place this arm on your belly. All right, on the count of 3, we're gonna roll. 1, 2, and 3. You can lift the towel up slightly to expose the back since that's the area that we're cleaning. You'll take one washcloth and wring it out over the basin. We don't want to drip any water on the floor or on the bed. You'll apply 2 to 3 pumps of soap and start to lather it. When you scrub this together, do it over the bed pad. If we get any soap in our basin, we'll need to empty out the basin and get some new clean water. When you start to see bubbles on your washcloth, you can begin to wash the back. Wash from the bottom of the neck all the way down to the bottom of the back. You'll take this washcloth and set it to the side. We'll get our final washcloth for rinsing and wring it out over the basin once again. Use this washcloth to remove any soap or bubbles you see on the back. You can now take this washcloth and set it to the side. Now that we've washed and rinsed the back, it's time to pat dry. Grab your drying towel and pat dry the back. When the back is fully dried, find a new clean spot on the drying towel, as we're going to need it one more time, and set it down on the table. Finally, we're going to give the resident a back rub. Take 2 to 3 pumps of lotion and warm it up in your hands. When we give this back rub, we're going to glide up the spine and do little circular motions downward on the outside of the back. Do this 2 to 3 times. We're now going to pat dry all of the excess lotion. We'll take this towel and set to the side for now. The resident has now been cleaned and given a back rub, so now it's time to clean up. If you want to ace the Florida CNA exam, you should know the full version of this course, GatorCNA On Demand SurePass, includes lectures, quizzes, and grading criteria for each skill. Sign up for a free preview at www.GatorCNAOnDemand.com to get access to 3 full modules and see why 92% of our students pass the state exam. It's now time to clean up. I'm going to start by removing these bed pads that have water on them. Roll them up until you reach the resident's back. Assist the resident in laying back down. Would you mind laying back down for me on the count of 3? 1, 2, and 3. Thank you so much. You can set this leg back out. And if you don't mind, please recenter yourself. 1, 2, and 3. Walk around to the other side of the bed to finish unrolling those bed pads. All right, Miss Calmia, on the count of 3, I'm gonna have you scoot towards me again and roll away. All right, we'll put this arm back down for now. Okay. 1, 2, 3, and scoot. Lift the knee highest to me. Lift the arm furthest away. And put this arm on your belly for me. And on the count of 3, we're gonna turn. 1, 2, and 3. Thank you so much. Now that I have the exposed bed pads, I can finish unrolling them. And can you lay back flat for me? Thank you so much. I'm gonna step away and take these to the linens. Always let your resident know before you're gonna walk away. We're now gonna take our used linens to the hamper. Grab all of the washcloths and your drying towel and take these to the hamper. Now we're gonna empty our basin by dumping it into the commode. Take the basin to the sink to finish cleaning it.
For further instruction on cleaning and drying this or any other basin, reference the How to Clean a Basin video located in the How To section of this course.
Use a barrier towel to open up your drawers to put away the soap and the lotion. We're now going to take off our gloves. Pinch in the middle and pull outwards. Bunch it up into your gloved hand. Take your ungloved hand and slide 2 fingers. Pull it outward. Throw these in the trash. Okay. We're now going to get our resident dressed into a new, clean hospital gown. We're going to take this with our clean hands and place it over the privacy towel. Gently dress the resident by putting one arm through each sleeve. Walk around to the other side of the resident to finish putting on the gown. Reach under the gown to remove the privacy towel. Make sure you're only touching the top part of the towel, not the part that's been touching their body. Bunch it up so you're not dragging it across their skin so you can avoid shearing. Walk across the other side of the bed to finish removing it. Finish removing the towel, then you can place it on your overbed table. Because the top part of the barrier towel has been dirty, we're going to reach from below and fold it in itself to keep our hands clean. You can now take this to the hamper as well. We're now going to ask the resident to sit up so we can tie the gown in the back. On the count of 3, could you please sit up for me? 1, 2, and 3. Thank you so much. Reach behind the resident and tie the gown. Guide the resident's head back down with your hands so they don't get an injury. Cover the resident back up and make the bed nice and tidy. Make sure there's no big wrinkles left in the bed that could cause pressure sores. Ensure the resident has enough room to wiggle their feet and toes. Make up the bed with hospital corners. Take out any furniture that you brought in and put it back where you found it. You can now do your normal closing statements. All right, Miss Kamiya, is there anything else I can get for you before I take off for the day? Can I get you a glass of water or put a TV show on for you? No, you're good? All right, well, here's your call light. Please let me know if you need anything. If this was the first skill on your care plan, you'll need to physically wash your hands at this point. If this is the second or third skill on your care plan, turn to your NAE and say, I will wash my hands at this point.
Thanks for watching. If this video helped, imagine what our full course can do for you. With step-by-step guidance, mock exams, and personalized support, GatorCNA On Demand SurePass gives you everything you need to pass your CNA exam. Sign up for our free preview at www.GatorCNAOnDemand.com to get access to 3 full modules to see why 92% of our students pass the state exam.
Thanks for watching GatorCNA On Demand. Don't forget to like the video, leave a comment or question, and subscribe to the channel for more support on your Florida CNA journey.